In the next installment of our series on doctors from Lake Wales who attended Lake Wales High School, we meet Dr. Ricardo Navarro, an internal medicine specialist, to learn more about his medical journey.
Joining me today is Dr. Ricardo Navarro, an osteopathic physician from Advent Health, Lake Wales.
Actually, I'm in private practice. We are affiliated with Advent, so we're part of their clinically integrated network, but I do own a private practice separate from them.
Now, for people who don't know what it means, what is an osteopathic physician?
That is a very long conversation that we could have, but to make it simple, osteopathy was created by a medical doctor back in the 1800s. His name was A.T. Steele, Andrew Taylor Steele. And he realized that through his travels during the Civil War as a medical doctor for the Union Army, that the towns that he went to that had more doctors had sicker people. I mean, this is a time where, you stub your toe, get a little infection, they're going to cut off your leg, they're going to give you all kinds of non-evidence-based medications to try to get you better, and a lot of times they didn't work. Actually, unfortunately for him, he actually lost his wife and 3 of his 4 children in the span of just a few months.
Wow.
Went into severe depression and just started thinking, I couldn't save my own family with the knowledge that I have. So he started pursuing other ways of looking at medicine. And at the time they seemed a bit radical, but they're really not. They're simple things like, treat the patient, not just the disease. Don't just treat the symptoms, actually, achieve a cure and work with the body and what the body does best to help fight, whatever's ailing the body. Instead of trying to force things upon the body, work with the natural mechanisms that we have built into us to try to help promote health. So, while yes, we can prescribe medications, we also take a more holistic approach, try to really encourage lifestyle, dietary changes, and we also can do manipulative therapy, similar to what a chiropractor would do, to try to help improve the function of the body as well.
Now, your journey to where you are now is kind of interesting because did you start out as an emergency medical technician?
I did. My father was a physician in Lake Wales for about 34 years. So our family has been serving the medical needs of this family since 1976. He used to take me on rounds with him whenever I was 3-4 years old. And so I've always been involved in the medical system from a very young age, even taking vital signs in his office for just a few dollars on the side when I was an early teen. When I became 16, I went to EMT school to get some experience and to try to gain a trade so I could work my way through college. And so absolutely, that was some of the best experiences I had in my life, and things I learned back then working on the ambulance and working in the emergency room helped me even to this day.
Oh, I'm sure. Now, the medical school you went to was in Bradenton.
Correct.
What was the name of it?
So it's a satellite campus of one of the main osteopathic schools. So it's Lake Erie College of Osteopathic Medicine, but at their Bradenton campus.
Now, was the fact that you were born and raised in Lake Wales the reason you came back from Bradenton to Lake Wales?
Absolutely. I really couldn't see myself going anywhere else. This is where my friends are, my family, and even though Polk County is a large county, there's a very small feeling to it because everyone knows everyone helps everyone out. And so I just really wanted to get back and contribute to the community that contributed to me getting where I'm at.
Yeah, and I looked, there are not a whole lot of physicians with your specialty in the Polk County area.
Right.
So you're a little different.
A little bit,
yeah.
A little bit.
But different in a good way. I
Absolutely.
mean, people are actually now seeking out osteopathic physicians, are they not?
100%. It's impressive. I have quite a few patients that will come to my office specifically because they were trying to find an osteopathic physician that still practices, some of those core tenets of osteopathy. And it is hard to find because, the way that our medical system is created and the way that it functions really doesn't lend itself to doctors taking that extra time with people to talk about those holistic things or to do manipulative therapy. So we really purposely for that time, we'll schedule more time with our patients so that we can make sure that we have the ability to do that for them because people want it. People don't want to just take medications indefinitely.
Yeah.
I'll tell you guys the same thing I tell my patients. Very seldomly does a true cure come from a bottle, whether it's a pill bottle, an alcohol bottle. If you have, there's a time and a place. Certainly, if you have an infection or if you have pneumonia, take antibiotics. But when it comes to a lot of the chronic diseases that so many of the Americans face, COPD, diabetes, obesity, there are ways to live better and healthier that don't involve a bottle whatsoever.
Okay. Well, thank you very much. This has been very interesting.
I appreciate the time.
Thank you.